Hey guys, Oscar here with Gastroenterology Simplified. I'm a board certified physician assistant, and today we are going to have a serious talk. We're going to talk about medications and we're going to talk about hemoglobin A1c. Before we go any further, I want you to understand that this video is for educational purposes only. If you have any concerns or questions, please refer to your primary care physician or physician assistant. Let's go ahead and touch the basis about hemoglobin A1c. Hemoglobin A1c is the measurement of your average glucose levels for the past 2 to 3 months. If you have a hemoglobin A1c of less than 5.7%, this means you don't have diabetes. This means the average glucose for the past 2 to 3 months have been normal. If you have a hemoglobin A1c between 5.7 and 6.4, this means you are a pre-diabetic, which means the average glucose for the past 2 to 3 months have been somewhat elevated. Sometimes normal, sometimes elevated, but it has been on average elevated. If you have a hemoglobin A1c of 6.4 or higher on 2 different occasions, this likely means that you are a diabetic. What do I want you to get here? If you have a hemoglobin A1c less than 5.7, congratulations, you're doing something right. Your average glucose levels are normal, your activity level likely normal, and your eating habits and lifestyle are amazing. If you have a hemoglobin A1c between 6.4 and 5.7, so less than 6.4 and greater than 5.7, this means that you are a pre-diabetic. This means that you still have the chance to change your eating habits, to change your lifestyle, to change your activity levels to prevent diabetes. If you have a hemoglobin A1c of greater than 6.4 in 2 different occasions, and if you are symptomatic, this means that likely you're going to have to use some medications, but most importantly here, you have to change your eating habits, your lifestyle, your activity levels to prevent complications from diabetes. I currently run a clinic, a virtual clinic, where I help patients understand their conditions. I help patients understand their medications. And something that I see that is concerning, I go over their past medical history and I go over their medications. And for example, I ask, I see that you have hypertension. And they tell me, no, I no longer have hypertension or high elevated blood pressure. I'm taking this medication for that. Oh, I see that you are a diabetic. No, I'm no longer a diabetic because I'm taking medications for that. Well, my friends, the medication is a band-aid for the actual problem. I like to tackle the actual problem. And in my personal opinion, I think we need to prevent the problem because in the long run, it's going to be better for you. Medications are just a band-aid. I know for some extreme conditions, yes, we do need medications to treat the actual condition. I understand that. But preventable diagnoses are preventable, meaning you can do something about it. I'm just going to give you another example here that does not require a medication. For example, colon cancer. If you are 45 years old or older, or if you have a family history of colon cancer, then the preventable way to check for colon cancer is to get colonoscopies. If you're older than 45, then you get colon cancer screening colonoscopies. If you have a family member or personal history of colon cancer, then you get colon cancer screening colonoscopies. It is preventable. You're trying to get to the issue. So, for example, if you have high blood pressure and you're taking medication for high blood pressure, this means you have high blood pressure. You're not doing anything to tackle the issue by preventing high blood pressure. For example, having a low sodium diet, having a low fat diet. So this is the issue that I see in the clinic, in my virtual clinic, that I help individuals understand their condition and understand their medications. One other thing here, in this clinic that I run, we actually have a registered dietitian that is included in the package. And let me tell you, I get more no's than yes, people agreeing to meet with the registered dietitian. It does not cost them any more. It's included. But they choose not to meet with a registered dietitian. Why? Because likely they're going to get the hard truth. Likely. And this is concerning, because I know so many diagnoses could be preventable. And what hurts me the most is that the medication is just a band-aid. I have family members. I have personal and I have family members that they prefer to take medications instead of changing their lifestyle, their activity levels, their eating habits. They prefer to take medications instead of changing that. In the long run, it's going to help you the most. And in the long run, it's likely going to cost you much, much, much less to change your eating habits than to take a bunch of medications. Some individuals actually have a bowl of medications for breakfast, and that is wild for me. Not only I see it in my clinic, but I also see it within my family members. It is completely wild. So in conclusion here, I want you to understand that a medication could be just a band-aid for the problem. If you're taking medication for this condition, this means that likely you still have this condition if you're taking medication for it. The medication is just masking it. That's it. So if you had the chance to change your eating habits, your activity levels, your lifestyle, meaning that it will better your condition and cost you way less in the long run, would you do it? I would do it. I limit myself to a lot of things. I do not eat this type of things. I don't drink alcohol. I have never smoked, and so on, because I'm trying to prevent chronic conditions. And I know many of us can prevent conditions. Lastly, for example, diabetes, because we're talking about hemoglobin A1c, which hemoglobin A1c is the average glucose in your blood for the past 2 to 3 months. So for example, when someone has a hemoglobin A1c of 13, 14, or the machine says greater than 14 because it can't read it anymore, this means that the diabetes is completely out of control. Completely out of control. And we all know that diabetes have many, many complications. For example, diabetes, this is something that I see very often. Diabetes could give you diabetic-induced gastroparesis, which I'm going to bring a video pretty soon about this. So if you find this video helpful, interesting, click like and subscribe so you can go ahead and see the videos coming up. Or another condition that I see due to diabetes, peripheral neuropathy, is because the diabetes is destroying your nerves. And that's why you have peripheral neuropathy. Just to close this video here, I need you to understand, and I know it is somewhat difficult because if you have been doing something for 30 years, it is hard to change overnight. And I completely understand that. But smaller steps will take you very, very far. One step at a time will take you very, very, very far. Understand that yes, you can change your future by changing your lifestyle, your eating habits, your activity levels, and so on. And your goal, at least in my personal opinion, my goal is to prevent chronic diseases. That is my ultimate goal. And I want you to have that. I want you to prevent diseases. I want you to have hardly any medications or no medications at all. This is so, so important because you can have a very healthy lifestyle and long life if you do so. I think this video is getting somewhat long, but I want you to understand this. I want you to know that you have the power to change your future and to prevent chronic diseases by making a few modifications in your lifestyle and also preventing taking a bunch of medications, because medications most of the times are just a band-aid for the issue or for the diagnosis. I want you to understand that. If you found this video helpful, please click like, subscribe so I can bring you more videos like this. Please don't forget to contact or to consult your primary care physician or physician assistant if you have any other questions. And if you want to see more videos from here, please check that video right here. And I will see you in the next one. Bye.